Hello, I'm Michelle Levander, Director of the USC Center for Health Journalism. Thanks for joining us today and welcome to our Health Matters webinar, COVID-19's Domestic Abuse Crisis. While COVID-19 has affected everyone, its impact has been especially harmful to those at risk for domestic violence, who are often locked down at home with their abusers. Calls to domestic violence shelters have plummeted, but advocates say that's a bad sign, as victims can't even get away to make an emergency call. And during the pandemic, there are plenty of ways that tensions can overflow and add to an already stressful situation: lost jobs, no school for the kids, and decisions on how to make money stretch to the end of the month. In this webinar, we'll gain a deeper understanding of how to assess domestic violence data during the pandemic, what nonprofits are doing to contend with a perilous and unprecedented situation, and how innovative approaches can help. We'll also talk about how to report on the situation with sensitivity to avoid putting anyone in further danger. Before we get started, let me introduce our featured speakers. Alaina is the Assistant Criminal District Attorney and the Chief of the Intimate Partner Violence Unit in Tarrant County, Texas. She has prosecuted cases from misdemeanors to aggravated sexual assaults and capital murders. Bang was formerly a member of the gang unit in Tarrant County. Since 2016, she is focused on prosecuting crimes against women. She is a past recipient of the Safe Haven Women of Legacy Award and the International Outlaw Motorcycle Gang Investigators Prosecution Team of the Year Award. She received her bachelor's degree from Southern Methodist University and her law degree from Texas Wesleyan School of Law. Adielle Kaplan is an investigative reporter with NBC National News. At NBC News, she worked on the award-winning International Consortium of Investigative Journalists Implant File Series, an international investigation into medical device manufacturing and regulation. Previously, she worked at Investigate West and the Miami Herald. She was part of the Miami Herald team that exposed millions of dollars of excessive compensation at Florida's largest domestic violence nonprofit. Deanna Paul is a staff writer at the Wall Street Journal. She previously wrote for the Washington Post and was part of a team that was a finalist for the 2019 Pulitzer Prize in Explanatory Reporting, revealing the vast number of unsolved homicides in America's major cities. Before her journalism career, Deanna spent 6 years as a New York City prosecutor, specializing in child homicides, crimes of domestic violence, and felony sex crimes, and as an adjunct professor of trial advocacy at Fordham University School of Law. Her work has also appeared in Wired, Rolling Stone, and The Guardian, and by coincidence, both Deanna and Adielle are graduates of the Columbia University Graduate School of Journalism. This webinar series is offered thanks to the Commonwealth Fund, the National Institute for Healthcare Management Foundation, the California Endowment, as well as individual supporters like you. You could tweet about the webinar at the hashtag #CoveringCoronavirus. A word about our format today: we'll be hearing from our panelists first, and then we'll turn it over to our audience for your questions. Because we have so many people participating in this webinar, we'll ask you to write your questions in the control panel of GoToWebinar. You can also write us there if you're experiencing technical problems. We'll be archiving this webinar at centerforhealthjournalism.org. And now let's turn to Alaina. Alaina, you are the Chief of the Intimate Partner Violence Unit in Tarrant County, which is home to Fort Worth. Tell us how the shelter-in-place orders during the pandemic have impacted the number and kinds of domestic violence incidents you're seeing, and how representative you think this is of other jurisdictions around the country.
Sure. So here in Tarrant County, obviously the Intimate Partner Violence Division, we specifically handle felony family violence cases. However, during this time period, we've also started taking a look at our misdemeanor intake cases, so what might be considered a first-time assault bodily injury. But going back to our actual felony instances, when we began originally in 2016, the reason for our division was we had seen such a spike in intimate partner violence homicides. And we've worked very hard over the past 4 years to build agencies to really reduce that number. And so by last year, we were down to 50% of the amount of homicides, and that was for a total of 7. This year, alone, after shelter in place began, we start sort of at March 1st when the governor started talking about it until present day, we have had 7 homicides that are related to intimate partner violence. So that's as many in this time period as we have had all year last year. So that's a very hard, obvious statistic that we can look at and realize, you know, in terms of anything else that we're looking at, that is what we know is happening at the same time as this pandemic and as shelter in place is happening. In terms of other statistics and what we're looking at, number of filings and things like that, it's difficult for us on the criminal justice side because we don't operate on a calendar year, and offenses are kind of labeled in a certain way that there's not necessarily a specific way to delineate severity of offenses. However, because we work very close with our partner agencies, our shelter, Safe Haven, our service provider, we've been following numbers in hotline calls and things of that nature. And as you mentioned in the introduction, they, as shelter in place was being talked about, received sort of an uptick in hotline calls. And then after that, there were days that we've gone during the shelter in place where they received only 1 call total when they averaged somewhere around 60. So that's staggering and very concerning. Another thing that they've noticed is once you make a hotline call and you're accepted into shelter, you are very frequently directed to a pickup point, you know, somewhere where it's safe to pick up. And they've had a lot more no-shows in general to coming to that location. So that's sort of indicative of what we feel like is probably happening in terms of crime, is that individuals are having an inability to reach out. We experience a lot of our referrals for crime, for intimate partner violence offenses when people are at work, when kiddos are at school and they can tell their teacher, when people have an opportunity to see their mom and their parents recognize something about them, and knowing what we know, that none of those things are happening, we believe that there are probably a number of things being underreported. We also have a number of offenses, sexual assaults in particular, that get reported when individuals are at the hospital. And we also just know nationwide, statistically, people aren't going to the hospital. People aren't going there unless it's COVID related. So we know that we're missing those referrals as well, or those references to police as well. So while it's difficult to say, we feel like there's a downturn specifically in what we have had filed, we feel like when we come out on the other side of this, we're going to be dealing with individuals who've probably been experiencing this in silence, more so than even before, even though we already recognize what an underreported crime it is. And so we consider ourselves a little bit lucky in the state of Texas. We have good laws. And so we know that we have an ability to prosecute things or enhance the level of an offense if we know it's happened more than once, if we know it's a strangulation, things like that. And so we feel fortunate that we're probably going to be turning to those laws to counteract what we've missed in this time period.
And before the pandemic, the Tarrant County District Attorney had put in place an interdisciplinary approach to domestic violence. Tell us about its components and how it has helped your community contend with domestic violence during the pandemic, and also talk a little bit about what its hard limits are, what it can't do in this difficult situation.
Sure. So again, that's something that we feel very fortunate about, that we sort of in 2016 had already started down this path, because now when something catastrophic hits or something comes like this, it's a lot easier to turn to the people that I know and the people that I'm already working with to say, what can we do, as opposed to starting from scratch and trying to find out who those people are. We're all already sort of at the table. But when we started looking at the domestic violence problem here, you know, it's 1 in 3 individuals will experience that in their lifetime in the state of Texas. And so that's a huge number, and we're not any different in Tarrant County. And so we know that we were missing individuals. We know that it's underreported. And so we started working very closely with Safe Haven, our shelter and service provider. We started looping in more specifically our police departments. We are a larger county. We have 56 different police departments here. And so sort of identifying who is it at each department who's working on family violence. We looped in our county hospital and the administration there, and also our sexual assault nurse examiners and the people there who are making those reports. Also our family justice center, who works with all the other agencies who can assist us in terms of housing, resources. And then within our office, we have a protective order division who can help our victims to receive a full protective order once an incident has occurred. So sort of already being on board with all those individuals, some things that we had developed, we have a standardized family violence packet that all of our agencies, all of our police agencies use at these incidents, that contains the Jacki Campbell lethality assessment, which is a short questionnaire that is asked to victims to identify what their risk of being killed by their partner is. That is so important to us because we can use it to identify our highest risk individuals, our highest risk offenders. We can also use it in terms of expert testimony. And then also sort of going back to what we know we've missed or identifying what's unreported, is those questions ask a lot about the past relationship. So while a case is presenting itself to us as a slap, which obviously we take very seriously and we consider serious, when we look at that lethality assessment, we see that there's a lot of other violence that's gone on in the relationship. And so we see that we're dealing with something a little bit more serious than a one-off. We're dealing with a pattern, which is what we identify as intimate partner violence. We also had developed the adult fatality review, which is where some of those same individuals come to the table and we review all of our intimate partner violence homicides each year to identify where our gaps in services are, where it is that an individual never knew to reach out to a shelter, never knew to call the police, never felt safe enough to do so, or prosecution missed the boat, let an offender go, and how we could improve upon that situation so that we don't have gaps, we don't have missed people who never got to us. And so, and then there's also been developed the high risk team, which is based on the Duluth model out of Duluth, Minnesota. And that's actually something that was developed by Safe Haven here in Tarrant County, but with our same partners. And it's identifying some of our highest risk victims and making sure that we're providing them those wraparound services from all of the involved agencies, that they're getting a protective order if they need to, that we're working with the Department of Family Services if that's who's involved, that they're working with therapy or medical if that's something that's necessary, if they need to move, if they need to get out of a lease. Our victims assistance coordinators here are also instrumental in helping in that process. So when COVID happened, knowing who those people were and being able to very quickly get all again together to determine, okay, how do we need to pivot, right? Because courts are closed. Not that they're not working, but we're not having people who are on bond come down here. We're not pleading cases. We're not going to trial. And so how are we keeping our victims safe during this? So we worked within that high risk team to identify quickly who are our most at risk, right? Those are people whose offenders are out on bond right now, who aren't in custody. So making sure that victim services were reaching out to those individuals, reaching out to our community supervision department who's dealing with the people who are on bond. If we feel like somebody's violating a protective order, making sure that we're filing the appropriate motions within the courts if we feel like different conditions are being violated, so that we're watching our offenders and also helping our victims simultaneously. So having all of those in place made it a lot easier to sort of reroute what we were doing to make sure that we, as we are sustaining right now, not kind of moving anything, but just sustaining, that everybody is being watched and also being kept safe.
One more question before we turn to our two reporters here. Your department is monitoring 50 people facing domestic violence charges who are deemed at high risk for lethal assault. Are some of these people who were released inmates who had been incarcerated for domestic violence? And is this a new program or a continuation of what you were doing before?
Sure. So that is sort of goes hand in hand with what I talked about when we talked about our high risk team. And that was sort of a development of individuals that came because it's a multidisciplinary group and several people are making referrals to that group. It was sort of added to by a number of different people, right? So we know who our highest risk offenders are because we evaluate that lethality assessment when we evaluate a case. We also look at prior convictions. So we knew and we know who of our offenders are people that we need to be paying attention to, especially then if they're committing another protective order violation or offenses are escalating, because we know what we can do as the DA's office within the courts to revoke bonds and things like that. Safe Haven also received some referrals from the community supervision department or probation department of who were victims that they felt like were at risk based on some of the behaviors of the defendants. Safe Haven themselves, obviously, as the shelter provider, knows from their end in the hotline who are their most high risk victims, because either they haven't reported yet, or they haven't reached out for services, or they're back with the offender. And so they also were making referrals to that group of who needs to be focused on. That one of the, again, big changes that happened amidst COVID was, let's turn and focus on the people who have offenders who are out, right, who might be back at home with their victim, and make sure that we're focusing attention there as opposed to people who are in custody. There was a push to let people out of custody. Obviously, I think that was nationwide, because they're in close quarters and it's a lot of people, and we have COVID in our jail, and I think most jails have some confirmed cases. And so it sort of always depends on how you identify high violent offender, right? Sometimes I think from some people's perspective, they're looking at, well, you're accused of a felony offense. Well, just like I was saying, you might be accused of a misdemeanor offense, and so somebody doesn't consider that a high violent offender. But I go back and look at a lethality assessment and realize this is the first time something's been reported, but I've got prior sexual assault, prior strangulation, everything on the power and control wheel going on here. And this is an incredibly high violent person, but it doesn't present itself that way in a criminal case. So some of those offenders are out. And so again, that's why, taking an individual look at the cases by all of those people is important.
Thank you so much. We're going to turn to Adiel and Deanna. You both have done major investigations on domestic violence during COVID-19. What did each of you set out to do when you launched these stories, and what were you hoping to learn that you hadn't seen reported before?
I can start. Well, so my past reporting on domestic violence had mostly focused on funding for shelter groups and following the money classic investigative reporting. But so one of the first questions I had was what was going to happen to these groups during this time. And I was seeing a lot of reporting about calls are, reports are going up or calls are going up, everyone's concerned, but I hadn't seen much about what was going on in the grassroots, like really on the ground of what shelters were seeing. And so that's what I wanted to look into. And I started with reaching out to a national source of mine, one of the kind of umbrella groups, to get a sense of, hey, like, this is what I'm thinking, what do you think I should be looking at? And through them, I was connected to quite a few shelters that wanted to share their stories, actually more than I was going to be able to talk to. Dozens of them were reaching out to me. So my reporting partner, Wilson, and I actually put together a Google Forms survey that we then sent to all these groups. It had a lot of yes or no questions on it. Actually, I can share it right now so you can see. But so this is basically, hang on, there we go. So this is our survey that we sent out. And if you've never done survey reporting before, I'm a really big fan of it, especially if you're trying to talk to a lot of people. So it was pretty straightforward. We asked a lot of yes or no questions. One of the things we were really interested in was, were call volumes going up, but also how have they changed what they're doing? We'd been hearing that there's more places working with hotels, so we asked questions about that. We asked specific questions about funding, and then when you get answers to all this stuff, you can read it in the survey. You can find the individual ones, and then you can also export it into a spreadsheet. So that's this little button here. And so that means if you do any data work and you have all these yes or no questions, you can start analyzing stuff that way. And from all of this reporting, that led us to here. Actually, that's kind of enough of the screen share. But from all of that led us to pick. I think it was 9 or 10 groups we ended up actually calling and speaking to directly to get a sense of what was going on there, and that we thought were going to be kind of the most compelling places to hear directly from. And one of them was actually Safe Haven in Tarrant County.
And Deanna, you come to this topic as a reporter with a really interesting background as a prosecutor in a former career. Tell us how that informed what you decided to do.
Yeah, so as you said before, I started my career as a prosecutor and specifically spent 2 years handling cases of domestic violence. And so when states began instituting stay-at-home orders and extended lockdowns, one of my first thoughts was, in this moment where all of us are being forced to be at home, for many, home is one of the more dangerous places. You have victims of domestic violence who are now forced to be home full-time with their abusers. And I think what COVID-19 has done is compounded a number of unsafe factors, things that we know to be unsafe, like unemployment and financial stressors and having children at home all the time. And a lot of the usual outlets, either resources or even just the opportunity to leave the house and go seek help, aren't available. We don't have social activities right now. We don't have religious services or gyms or anything like that. And all of that kind of creates a perfect storm for a relationship that had prior abuse or psychological abuse to escalate to violence or severe violence. And so when my colleagues, Usha Allenson and I began reporting on this, we had heard that there was a decrease in the number of reported instances of domestic violence across the country. And we wanted to know if that was true. We wanted to know what that meant. And we also were trying to be forward thinking in our reporting and kind of look to see what law enforcement and other agencies were doing that were innovative and creative to be able to give access to victims of domestic violence who are now stuck at home.
And Adiel, you talked about your methodology, but wasn't some of this influence your decision to take this approach by just how hard it is, especially now, to try and reach potential victims?
Yeah, I mean, when I set out to do this, I did not have a plan or expectation to talk to a domestic violence victim. And one of the reasons why I wanted to approach shelters was I was looking for other narrative ways to tell this story, to tell what was going on, again, like on the ground. My initial idea for it actually was to find one shelter that was really struggling to adapt or going through a lot of changes and almost do like a day in the life or like a week in the life of a couple of advocates at this shelter. That was my early plan. But we started hearing from so many groups, we decided, well, we can actually get a really wide snapshot here. And that ended up expanding. And there is, if you read the story, there is actually, it does start with a victim's personal narrative who was just a really compelling person to talk to, but I didn't plan on speaking to her. And in fact, the first draft that I gave my editor was, in fact, it started with profiling a shelter that had to close down for a couple weeks while it retrofitted to be able to be a safe space. And my editor came back to me and said, it would be great if you could get a victim, it would be even stronger, which I knew we were going to have that discussion. And I told him I didn't think I would get one, but I agreed to go back to a few of the groups we'd spoken to that, I'd already had 2 or 3 interactions with and asked them, is there someone who would talk to us or provide a quote or two? And I think we asked 6 different shelters and 2 of them said yes. One provided a few quotes that we didn't end up using for that piece. And the other said, actually, yes, there's someone here who would find it an empowering experience to speak with you anonymously. I was very surprised by that. I don't think that that's a norm in this kind of reporting, especially right now. These victims are even more, it's just such an even more stressful time for them to be in an already extremely stressful position. So I just don't think that's an expectation we can have on these projects.
Do you, Adiel, have a suggestion, or Deanna, of how to have that conversation with your editors about that? Because I think there is always an impulse to want to put a human face on a really traumatic situation like this one, and yet it comes with a lot of risks as well.
So I think what we did, we of course wanted to include the human toll in the story. And so what I found is the people that work in domestic violence, whether it's agencies or law enforcement, everyone's end goal is really the same, is to keep the victims of domestic violence safe. And in this instance, to bring awareness to an issue that's still ongoing, even though we're all being home and even if the numbers are going down. And so I found if you approach it that way, that you're writing a story to to bring that to light and talk about this issue, everyone, Alaina included, has been nothing but helpful. And we kind of approached it by going to the on-the-ground frontline workers and people that were staffing these hotlines and text message lines, and people at the shelters and prosecutors who are actually seeing the cases come in and listening to what the women are saying to them on the phone. And that was the way that we brought in the human aspect and some really compelling and tragic anecdotes.
Yeah, I think it's much more. So these are such important stories to be telling right now. You know, I think in your local community, nationally, wherever you are, you can find a way to pitch a story that should be able to stand on its own, even if you didn't have any characters in it. And these are just such important stories right now. But then within that, you know, the human angle, the people that are doing the job, like I think the beginning of Deanna's story profiled someone who was answering a text message hotline. Those are really interesting characters right now. One of the groups we spoke to in Hawaii, they said the calls they were getting were increasing in the level of trauma that they were hearing about, enough that they started providing more mental health services for their own staff. I would want to talk to one of those staff members and hear their experience. I think that's an equally valid form of getting a human perspective in there.
If I can just add also in terms of, you know, getting a prosecutor to talk to you, you know, something amidst this situation that's obviously everybody hears about every single thing as it's closed, right? You can't go to the DMV, you can't go anywhere. And the thought, you know, across the country is everything's closed down. And so something that was important and that we wanted people to understand and what we want people to know is that, well, we aren't, you know, we're open. Again, it looks different, but 911's open. Your shelter is open. Your DA's office is open, right? You might hear my kids in the background, but I'm working, you know, I'm doing the things that I'm trying to do to still make sure and keep you safe. And you want that messaging out there because again, it's, you know, the reason why a lot of victims stay in those abusive relationships is because it's what they know, you know, and sometimes just the known is less scary than the unknown. And so add in this situation and the thought that, okay, now I reach out and nobody's going to get back to me for 6 months or 6 weeks. We wanted them to know there is still somebody out here. There's still somebody working on this. And so that, you know, when the media calls and you feel like you can let that message get out there, I mean, that's important on, you know, as a service provider.
A question for all of you, what are some of the unique challenges when it comes to both helping domestic violence victims who come from hard to reach communities and communities living in poverty, and what are some of the reporting challenges, and how can you best serve people who are already fearful before the pandemic?
I can start. So obviously, I mean, what we know about domestic violence is it's not specific to any community, you know, and this is the wealthiest part of town and the poorest part of town. You have the same sort of violence going on, and you have, you know, a lot of similar traits of offenders. But we know that added in stressors, right? That you're not, if you report this now, you're not going to have anywhere to go or anywhere to take your kids. That is an added level of fear. Again, that unknown. Now, what's going to happen to me? You know, we also have a lot of people who fear reporting because they feel like they're not, you know, their citizenship is going to be an issue. And so, again, that's something that when we talk to the media, that we want people to understand that that's not going to matter to me. I'm going to take those things just as seriously no matter where you live, because, you know, if your face ends up on a slide that is a fatality in Tarrant County, it's not going to show where you're from. It's just going to be another death in this county that we wanted to prevent. And so, but the difficulties in reaching some of those communities can just be those same things. There's some distrust of police, and that goes right to prosecutors as well, and to the criminal justice system, you know, thinking that I've called before and it didn't work, that nobody's coming back. And so making sure that we as the DA's office take each case seriously so that they understand that we're going to do everything that we can. And if we can't, that we're going to provide an explanation, that it wasn't just because you didn't matter or this wasn't important. And kind of providing that outlet again, that we're here and that we're working. And so if you feel like you're not getting taken seriously, call us up, you know, I mean, and, you know, and squeaky wheel can get the oil. And so that just trying to be present for all of those communities is just something we work on.
I think jumping off what Alaina just said, right now, because of COVID-19, there's also this added concern amongst victims of domestic violence that shelters aren't open, or even if they are, because there's an influx of people, social distancing is impossible, or they've heard maybe that prisons and jails are releasing inmates to curb the spread of the virus. And so why would I call 911 if my partner or spouse or whomever is going to be arrested and then be released right back home?
And Alaina, you talked about how in just a few months of this year, you saw almost the same number of homicides related to domestic violence as all of last year. I'm wondering what you're seeing and what the reporters you are seeing in terms of other kinds of incidents and their severity when they're not homicides.
So again, and we've been asked that a lot. And again, our Safe Haven, who is dealing with the hotline and taking those calls, can kind of put a better number on it, because it's difficult for us to evaluate the difference between this aggravated assault and that aggravated assault, except for anecdotally. But I mean, we've had strangulations. I mean, again, just as Deanna was saying, it's a pressure point, right? And then there's already abuse happening, and now you're together all the time, and you have the added stressor of your kids are home all the time, and nobody's working, money's not coming in. And so what might be a small assault, when it's given a little bit of time, it's becoming these more severe incidents. And so we've had a lot of those. We've had some offenses, and I think I mentioned this, that you can tell are directly related to COVID, where there is something that turns very violent over a stimulus check. Economic control is a very big part of the power and control wheel, and where that money got deposited can be a element of controlling another partner in your relationship. We've had offenses that I've read that are directly related to homeschooling your kids and having your kids at home and who's in charge of that. We've had offenses that are clearly directly related to people who wouldn't typically be intoxicated in the middle of the day, but they're not going to work and they don't have any other responsibilities during the day, and now everybody's drinking or using drugs in the middle of the day, that sort of thing. So things that you can look at and know that are directly related to what's being caused by COVID.
To echo Alaina, even though we didn't see a common trend in the various hotlines, whether it was national hotlines, state level hotlines, local level hotlines, the one thing that myself and my colleague heard consistently was that there was callers that were calling in, there was an increase in the severity of violence, and also that they were citing COVID-19 as a trigger, whether it was coughing on their partner, coughing on them and saying they had COVID-19, and then they were too scared to leave because they didn't want to expose their elderly parents to the virus, or using strangulation or using weapons in prior abuse where they hadn't done things like that.
Yeah, I mean, I heard a lot of the same things that Deanna did. One thing that we did find is in this survey, we asked if call volumes were going up, if they were going down. A lot of places provided the percentage, and in some, they rose 200%, and others they went down 30%. There were a few places where I think actually quite a few where call volumes went up right before a stay-at-home order and then dropped down and then slowly crept back up to normal. But the call volumes themselves, there were so many potential factors in why they could be changing, in why they were different some places or others. That wasn't necessarily like a huge data point that told you what was going on, because everywhere we talked to, regardless of how their call volume was changing, listed the reasons behind it as the same stressors that we've been talking about this whole time. And what we were hearing pretty consistently was, like Deanna said, there were a lot more shorter and more frantic calls, people, whispering in a closet that their abuser was in the next room, things like that. I also spoke to some sexual assault nurse examiners who were saying that they were seeing less cases coming to the hospital, but when they did, they were again much more severe, and in some cases, more violent and brutal, and sadistic in particular.
Something else I'll also note that was interesting to me, I guess, various hotlines, again, regardless of it being national, local, state level, whenever their number or website or however it is you reach out to them is blasted on the internet or on media outlets, whatever that is, they all usually see a surge in calls. And during COVID, that wasn't happening. So even if their regular calling in numbers were on the lower end of the average spectrum, they were concerned to see that there wasn't this big spike in calls given how frequently their number and email and everything else had been put out into the public realm.
Adiel, you looked into what the crisis has meant for the funding and sustainability of organizations that help domestic violence victims and survivors. What did you find there?
Well, there is some good news, which is that actually a lot of the groups that we spoke to talked about how when this started, they got a swell of community support. There was a group in Missouri that got a $10,000 grant for emergency housing for victims. There's been a lot of pushes as they've needed to create space in shelters. Many places are finding alternative housing sites, often hotels, to keep families in temporarily. And so this group in Missouri had gotten money to put people in hotels, and I think they had like 20 people in hotels for a month based on that money, something like that. And so there were all kinds of examples of things like that, where in the short term, communities were really rallying around these organizations, knowing that this was going to be a big issue during stay-at-home orders. But in the long term, I think like with all nonprofit funding, given that the economic situation is so much less certain, these groups are all worried about their future funding, especially because they're all predicting that regardless of what they're seeing during the pandemic and during the stay-at-home orders, as things open up more and more parts of how we socially interact, there's just going to be more opportunities for people to seek help and seek shelter and things like that they're going to need more resources. And a lot of them miss their annual spring fundraiser. These are community groups, and many of them do get a sizable chunk of their income from hosting a big luncheon, or I think one does a beauty pageant somewhere. They have it had a really cute name that I can't remember. But there are all these great ways that these groups have over years and years, done these annual fundraisers that they can't do now, and they're suffering from that. One had a thrift store that provides 30% of its operating budget, and that had to close down for 2 months. Another, I think actually one of the ones in Texas gets some of its unspecified money from some oil rights actually, but those aren't really bringing any money in right now. So it's all these different financial challenges that are coming up for these groups. And I think just long term, it's a question of how do you keep providing services when everything's so uncertain.
And I'm wondering, speaking of nonprofits, did you find, separate from their financial situation, that there are ways that they have adopted their approaches to these really challenging situations where it's harder for people to call and so on? What did you all see in the field in your reporting? And Alaina, what are you seeing in your work as a prosecutor?
Well, I can tell you, so obviously our service providers provide a lot of counseling, and I mean, besides just shelter, right? Because shelter, it's not the long-term solution, but they provide a lot of counseling and things like that. They also, our service provider provides our offender program. So if an offender is placed on probation or is dealing with something with CPS or something like that, they go through the offender program, which is a 27-week program, which is really based upon a group dynamic, and we don't have groups. So I mean, having to figure out how to coordinate those things via Zoom or via some sort of online medium and trying to still have the same effect. In the criminal justice system, obviously, it's incredibly complicated because we can't have 85 people come down for a docket. And so the people who are on bond and not in custody aren't coming to court dates right now. As the Supreme Court said, at least until June 1st. And so, that's a little that's certainly concerning. If we have to have a hearing, we need witnesses, things like that. That's complicated too, because you start to wonder, okay, yes, we can do those things via Zoom, but if the victim is testifying and not at my office or not in the courtroom, perhaps she's back with the offender and that person's testifying from the defense attorney's office. Well, I have a big objection to that, because I would like to know what's going on the other side of the computer screen. And so, those things are incredibly complicated because, you have confrontation clause issues, you have due process issues, and this is also going at a time of, a big push for criminal justice reform. So a lot of people just aren't in jail. And, we can deal with our offenders who are in custody a lot easier in terms of the electronic abilities of that. But it's those cases where they're not, that it's very complicated.
I think some of the other things that we saw, the New York State Office to Combat Domestic Violence, they launched a text message line and an online confidential chat service for victims of domestic violence who weren't having the opportunity to leave the home and call, could go in the bathroom. And one of the first messages the text line got was, "This is my only opportunity to write in. I'm sitting in the bathroom right now." In San Francisco, the district attorney rented out a number of hotel rooms for victims of domestic violence. I believe in Delaware, they bought a number of burner phones with prepaid minutes and data plans for victims of domestic violence to use to access help.
Yeah, there's definitely quite a few groups that have rushed to get these text message hotlines set up, but not every group can do that. It's more involved in setting up a phone hotline in a lot of ways, and there are definitely places that this had been kind of in their plans for a while, and those were the ones pushing that forward. But so while that might not be happening everywhere, there's lots of ways these groups are innovating. They're very agile in terms of that. They've figured out how to. A lot of them have these shared kitchen spaces in their shelters. Well, now they have staggered meal times. They're doing grab and go meals. Some of these places that have put a lot of people in hotels, a lot of what they do now is figure out how to be basically caterers for these people who don't have access to kitchens and may have children with them. There's all this e-filing with the courts now going on with protection orders. In a lot of places where that didn't exist before. Both of you actually, I'm sure, know more about how that's historically worked than I do. But I think that's something that is probably a big change that'll probably stick around, I would imagine.
And that leads me to my final question before I open it up to all of you in the audience. If you have a question, please go to the control panel and type it in, and we'll call on we'll read out as many of these as we can in the time that we have. So I'm just wondering, to your point about some of these new methods, whether you think that there's been lessons learned or approaches tried during the pandemic that could have a lasting effect on how domestic violence is approached or lead to some sort of policy change. Is there any kind of silver lining here?
I mean, I definitely think, and Alaina also can probably speak to this better than what she's doing now, but a lot of the things that we're seeing in terms of e-filing orders of protection and having online ways to track what's going on in cases. The criminal justice system in many places was still stuck in a pre-digital era timeframe. And I think what COVID did was fast track things that a lot of places were already planning on doing. But I do think those will stick around after the pandemic has come back to some semblance of normalcy.
And I can agree with that. I mean, I think obviously there are some challenges that I think we're going to face when we get back to trial. But I think that some of the other processes that even in a large county were a little bit antiquated. Why were we bringing people all the way back from prison to plead to some, the transporting, things like that are unsafe, things that could have been handled and the time frame that they can be handled in is quicker if you can do it this way. I mean, I think certainly some of those things, I think those things will stick around. I also think that, just generally going back to the thoughts of multidisciplinary group and working together, I mean, you're sort of forced to in this sort of situation, right? Even if you didn't want to be with your community partners, you have to be because you're addressing something and you're also looking at the horizon where you feel like you're going to realize that things have been bad and you didn't know about it. And so for communities that didn't have that set up, I feel like they're probably getting around the table in a quicker fashion to try and work those things out, because I think the resources are limited and you have to. So it's somewhere where we felt fortunate that we were down that road, but I imagine in other communities, they're feeling like we need to get that going.
And now we're going to just turn to some questions from our audience. We have a question from Celia Clark, who says, and I think this question for the reporters, how did you get information from hospitals? Did they provide it, or do you obtain it through law enforcement records?
So I didn't directly speak to hospitals. I've spoken to some groups that do sexual assault nurse examination programs, so that conduct the actual rape kit exams in the past. And I checked back in with them on this. I didn't end up using any of that in this particular story, but that wasn't, specific data necessarily. That's more of getting some context on anecdotal reports. But I would think most of this would come from law enforcement more than hospitals.
That was the same with our reporting. Although I will say in other stories, we've been able to reach out to doctors who have been willing to speak with us on the condition of anonymity.
And we have a question from America Barcelo, who asks about how to get data on the number of offenders that are released due to COVID and go back home, and specifically for offenders that have not been in court or been sentenced.
So I've been asked for that data from several people, and it's a non-answer, right? And it's, again, that the situation is we just don't operate on a calendar year. So even if I can pull numbers that say who got out since March 1st, that person's offense might have been committed in September of last year and they just got picked up. So that it's hard to put a number on. I can say that obviously a very large number of offenders were let out of jail, but I know that the push to do that was due to COVID, but it's difficult to put that. And then also kind of speaking to that same issue of being in the midst of a criminal justice reform situation, it's difficult also to say, okay, compared to last year, March, these couple of months, well, because that situation was to be improving anyway, so it's kind of hard to say that it's necessarily because of this. So that I think anytime you're trying to pull those numbers and pull that data in the middle of it, I just feel like it would be a little bit, it's a little unfair because you don't know, you don't know, are you making the numbers say something that they're not, just because you don't actually know what you have in front of you. In terms of people that have gotten home, a lot of, it's kind of what is home, right? A lot of our conditions are required because of protective orders that you can't have contact. So, that's going to come up to offender telling the truth or victim telling the truth about whether or not there's contact or whether or not there's somebody actually back at home, unless you're on a GPS monitor. And I would tell you that I believe that our community supervision department would tell you that the number of people on GPS monitors is substantially higher right now, because if they're going to be out, then that's going to be a condition on a lot of these cases.
And Lucy Walinka says, how do you report on cases where the perpetrator also has a likely mental health problem and not demonize the person with the disability, but at the same time not minimize the victim's trauma?
I think for our reporting for this story, it was more about the challenges posed to domestic violence cases by COVID-19. So it wasn't about demonizing the abusers, and that was really the focus of the story.
Yeah, I think in this context, because we're talking about systemic level issues and systemic level challenges, that this isn't necessarily the kind of story where you tell a really in-depth play-by-play of what the abuse and the fight that led to the survivor leaving was, and where you don't have to really focus on that. If you're telling a much longer narrative feature, then that's kind of the general challenge of trauma reporting is how do you tell a compassionate story and it pulls all these factors in and gets at all of those challenges. And that's that's something where you can check out the DART Center for trauma reporting. They have a lot of really great resources on that kind of stuff. That isn't necessarily my forte in particular, but there's lots of reporters that are truly masterful of that.
And Priscilla Marin says, what is being done for those with limited English proficiency? There's been evidence that those with limited proficiency are highly underreported.
I can tell you from the criminal justice side, I mean, I think for starters, each of our 911 departments is equipped with the ability to call the language line, and we hear those 911 calls all the time where they very quickly identify that this is a different language, whatever it is, and can connect very quickly with somebody so that that person can get the information. We have, I would say, I mean, most agencies have bilingual individuals who can report out. I've even just seen there's officers out at the scene and here comes the ambulance worker and it's, hey, do you speak X? And so then, you know, let's just, you know, try and figure out how to work through this if it's the emergency situation. In terms of once the case is at the prosecutor's office, we have access to not only our language line, but there's also a sort of language line that's run out of Catholic Charities. And I think they service, I mean, 60, 70 languages, and we utilize them all the time, or we pay translators, the courts pay translators, because they have to also provide translators for the defendants. And so I do think, I mean, I think that population, oftentimes I do think it's incredibly underreported. You know, that for us is a messaging issue, you know, a use of media that's not something we're going to be concerned about. You don't have to be afraid of that. You know, if you are being abused, that's not a concern of ours.
We have a question from Jennifer Castle who says, how are the rates of domestic violence tracked each year, and how are the rates of homicide connected to that domestic violence and separated from the overall homicide rate?
Alaina, you probably have the best insight.
Sure. So we obviously we're paperless here. Paperless is sort of, I'll say paperless. There's a lot of paper in my office, but we have all of our filing system is online, and so with all of our police agencies, and so we tag things as they come in, as intake looks at our cases, and can identify if something, obviously, what level offense is it, if it's a homicide, something like that. There are specific individuals within the office who are going to evaluate each homicide and determine if they are intimate partner violence related. Now, sometimes that can be a misnomer, because if a wife kills their husband or a husband kills their wife, it doesn't necessarily mean that that's intimate partner violence, because that's a pattern, right? Sometimes it's a one-off situation. There's something else going on in the house. So that's sort of then where we have our adult fatality review, where we sit down and we look at the whole history, what was going on with CPS, what was going on with prior reports, what did the DA's office know, what did the hospitals know, and so was this a pattern that we didn't know about? In the state of Texas, the Texas Council on Family Violence also does an Honoring Texas Victims report each year, where they calculate those homicides from every county in the state, and they issue a report at the end of the year. There's also a central reporting agency for us. It's the Texas Department of Public Safety, where all of our law enforcement agencies report in their statistics on crime. So when they, get a strangulation case in, they fill out literally like a bubble sheet, and it gets sent in, so that the state is also keeping those numbers. So the numbers of offenses are not as hard to track. It's a more specific review to determine, was this intimate partner violence or domestic violence related?
And I will say, at least in the offices that I worked, I was in New York City, but in Queens and Brooklyn, there were statutes that classify domestic violence as people who were married, who have a child together, or who live together. And so that automatically went to the Domestic Violence Bureau. And so I'm sure that's how they track those cases there.
And we have a question from Emmeline Fangay, more of a statement in a way that raises an interesting ethical and boundary question for the reporters here. She said she's listening from Cameroon, and as a human rights journalist, I know the procedures of reporting domestic violence. I tried helping a victim, but she declined. She's pregnant and gets battered by her husband, who's a military man. So when you're reporting, on someone in a dire situation, what boundaries do you draw as a reporter on, whether you would intervene in any way or just how to handle those kind of really fraught situations?
I think at the end of the day, someone's life and safety comes before your story. That's kind of the principle I've always operated on, which is that, I want to tell the story. I think it's important. Like when I'm asking someone to share their personal narrative with me, I think it's important. But at the end of the day, your safety, your security, your anonymity all comes first. I think that extends beyond just whether or not they're in your story. Like if you know who to connect them to and they're actually at risk, then maybe they're not the person whose story you tell. Maybe you're just connecting them to the service provider. There may not be a lot more than that you can do, but like that's at least just how personally I would be comfortable acting in a situation like that. That's a really tough one.
Yeah, I think that if you're aware of the resources for the specific jurisdiction or area that they're in, it's important to let them know that there are these places that they can reach out to. But I do think that victims of domestic violence will only reach out when they're ready to reach out.
Just by way of research on that issue, I mean, it takes an individual 7 to 8 times to leave their abuser. And also, just like Deanna said, I mean, we trust that victims know their situation the best. And we also see the highest number of our homicides when people are leaving. And people, I mean, it's a real threat when somebody says, if you leave me, I'll kill you. And when they've said, if you leave, I'll hit you, then that has happened, that they know that about that. And so I know a lot of times as outsiders looking into that relationship, you want to do something to help, you want to take them out, you want to take them under your wing, but sometimes that loss of power and control for the abuser is the most unsafe thing that can be done for them, even though it doesn't look that way. And so kind of going back to connecting them with the resources so that they can get out when it's safe. It's why we as prosecutors we're not going to force trial upon you. We're going to evaluate our case without you because we know that same thing, that you can't force this on someone.
And I think that goes back to what Alaina had said, what she's seeing from Safe Haven with the shelter system in Tarrant County, that a lot of victims have been able to find the opportunity to make the call to seek out help, but they haven't yet been able to find that opportunity to leave.
And we have a question from Anjira Rojas, who is writing from Venezuela and says, I've read that it's advisable not to tell a victim's story if she's still a victim, that it's better to do it when she's already a survivor and out of danger. But during the pandemic, this is almost impossible. So how do you tell the story without putting the victim we interviewed at risk? And Anjira goes on to say that there isn't really a shelter system in Venezuela either.
Mm-hmm. I mean, whenever I've talked to people in situations like this, I guess the example would be the woman we spoke to for our story. The conversation was done with her caseworker on the phone with her. I think they were in the same room, I'm guessing 6 feet apart. And the way we started it was just, here, we're gonna do this conversation on the understanding that it's going to be anonymous, and at the end of it, we'll talk about any of these specific details that you've shared about your family life, about where you live, and before I go to print, I'll check back in about anything that could be identifiable about you, and make sure that that's still, that these details aren't too specific, and that aren't going to put you in more jeopardy. This woman was already away from her abuser, but she was married to him. They weren't fully divorced yet. They had 2 children together, and so where we ended up with that is I gave her the option of, do you want to be completely anonymous? Do you want a pseudonym? Can we use your first initial? Could we use your first name? Can we say what town you lived in? Can we say the number of kids you have and how old they are? How specific can we be in terms of the date you left the apartment, in terms of what happened right before you left? And it was all of these like very minute things that we went through, just so that she was comfortable and so that everyone was on the same page about, how much risk were we putting her in by putting her story out there.
We also, because we didn't speak to a victim directly, we went through people that were working at the hotline and, you know, staffing the text messages and to prosecutors, they were already somewhat not as specific as IDLs, but we were careful about using gender, about using certain details that would have made the person too identifiable as well. I think anonymity for them is really, really important.
We have a question from Robert Pezzalessi, who says, there have been reports of spikes in excessive alcohol use during the pandemic. Have you seen any indication that this is impacting the domestic violence crisis?
So I can tell you that it goes hand in hand quite a bit. You know, you have alcohol and drug abuse and then there's violence. And I can't probably put a number on that to say that this is something that is happening more frequently. I will say that you do see some of these things that are happening more time in the daytime than you would have initially anticipated. But, you know, some of the confusion can, you know, that for victims, I think also it's a little bit of a barrier to them is that they feel as though if this person just wasn't an alcoholic or if this person just wasn't a drug user, then I wouldn't be experiencing this violence. And so sometimes that's an inhibitor to our victims because it's not necessarily the right way to think about it, because there are plenty of people who drink to excess. There are plenty of people who use drugs and they don't become violent. But in the victim's nature, they feel like that's what needs to happen to fix it. And so it can be a little bit of an inhibitor in terms of how we can approach getting a victim to be cooperative, because that's the help that they think an individual needs. They see it as an anger control issue. And again, there are lots of people who get angry and they don't ever hit anybody. And so, you know, abuse is a different issue than that. However, certainly it's not going to help. The other inhibitor that it certainly is for our victims is if they themselves have a drug or alcohol abuse issue. You know, they don't want to call the police because they, you know, are also dealing with a narcotics problem, or they're in possession of narcotics. And so even though they're dealing with something that's very abusive and very violent, they feel like, well, I'm just going to get myself in trouble. So that is certainly, alcohol and drugs certainly play a role in domestic violence. I think it can just be a little bit different than the way people think it does.
Also, on the danger assessment that Alaina had mentioned, the Jacki and Campbell danger assessment, substance abuse is one of the risk factors. And I will say that one of the calls that we were told about was made when their partner left the house to go to the liquor store. So that was the one free moment that they had to make the call.
And we'll just take a couple more questions here. One is from, I'm going to sort of pair these because they're connected in a way. One is from Michelle Salas, who says, Alaina had mentioned issues that develop from power dynamics and the power control wheel. With stay-at-home orders, what do you advise for a person that is dealing with strong dualities to protect themselves in that type of environment, to keep themselves safe and stay resilient and not cave into the oppressive circumstances? And I'll just read this other question that feels sort of in the same territory from Mary Contreras, who says, there is such a culture of she should just leave, and how do you go about changing that uninformed opinion?
I mean, from a prosecutor standpoint, I mean, we do a lot of trying to educate. We do a lot of it in this situation during, you know, during voir dire or jury selection, you know, which is not something that's available to us, but that's when I get to talk to the most people, you know, each day in my community. However, we do a lot of training with police officers. We do, you know, because if they're an officer that has to go back to the same house day in and day out, and that's their standpoint is, why won't she just leave? Why won't this person just leave? They're going to become apathetic to that situation. And so helping to train our law enforcement and our frontline individuals to understand that it's not a question of why doesn't she just leave? That's not the right question. First of all, the right question is, why won't the abuser stop hitting them, you know, or being abusive? But also understanding a lot of times the power and control wheel is the most important tool to show the victim, not even necessarily the people who are working with them, because they believe, I mean, a person knows that they are being assaulted when they get hit or when they get raped. They don't necessarily understand how they got there. And so when they look at the power and control wheel and see, oh, I'm not allowed to have a car. Oh, I don't know what my bank account is or the access code to that. Oh, that is interesting that I used to see my mom every day and now I only get to see her every 6 months, and how things sort of chipped away so that you are in less control of everything in your life. And so that tool is used a lot of times just to open up a victim's eyes to, while this isn't abuse as you know it, it is abuse in that this is how this person got control over you. So we have to do a lot of training just within ourselves. Even as prosecutors, you can get very apathetic to the same people coming in and out, and that thought of why won't she go away? Why is this person taking that? But having to realize I can't take that personally, and just similar to knowing that that person knows what's the safest for them. This is why they're taking this. This is why they're not leaving. This is why they're sustaining this, that sort of thing. And so those are some of all the tools that we use in training that we try and do to kind of just educate the community of those things.
Yeah, as a journalist, I think in every story we do about domestic violence, first at the top, you should have the resources available to people nearby. If it's local, the local domestic violence hotline number, or the national one. Lately, I've especially been making sure to include the text message line because that's so important right now. And then also, get an expert quote in there saying what Alaina just said. Get someone explaining in every story about domestic violence that is, it's not as simple as why didn't she just leave? And that there are so many factors in that, because that will give nuance and context to the story, regardless of what angle of this you are particularly focusing on.
And we have a question from Candice Montague, who wants to know if any of the panelists have experience with domestic abuse against elderly people. There are many families that are adapting to an elderly family member moving into the home, or vice versa, due to the economic downturn related to the pandemic. And the person asked if you have advice on how to research this topic.
We definitely heard stories from the National Hotline about, I don't know if necessarily elder abuse, but about an adult child moving back into the home and being abusive with the parents. So perhaps reaching out to local, national, state level hotlines and seeing what they're hearing, and they might be able to point you in a direction.
I would agree. We've seen a lot of, people are having to find somewhere to go live and to be, and a lot of times that's back at your parents' house, and that can be a stressful situation even as an adult. And so we see a lot of that in the state of Texas. If you're over the age of 65 and that's an abuse situation, it's going to be enhanced to a felony. If it's an elderly person, sometimes it can be a little bit tricky when the elderly abuser is also an elderly person, right? It's just an older couple. And so that can be a little bit complicated. A lot of times it's been a long-standing relationship. It's been something that's been going on for a very long time. In terms of, I think the person was asking about the statistics on that. I will tell you, elder abuse statistics can be difficult. I know that we've tried to do elder abuse statistics in terms of homicides, and it's difficult because it's difficult sometimes to identify, why did this person die? Did this person die in a hospital because they were elderly and of old age and of disease, or was there something else going on? So I think the people who do that research would tell you, and I'm not one of those people, would tell you that is a difficult statistic to sometimes find.
In terms of reporting on it as well, there are not as many of them, but there are advocacy groups that focus on this issue. And I think in all of this victim-centered reporting, that's always where you start, is asking these groups what they're seeing, showing your interest, being really engaged, and actually, not going in saying, hey, I want to talk to a victim, you can connect me. It's figuring out what the story is from the perspective of the people on the ground, and gaining their trust and working with them on these things. It's like Deanna said at the beginning, these stories where we're talking about victims and survivors, pretty much everyone you're going to talk to is on the same side in this, which is no one wants more domestic violence or more elder abuse in our society.
There's also a lot of district attorneys' offices do have elder abuse units. And so that also might be a place to go to. We've also had a lot of success with reader callouts and submission forms on stories. So that's another idea for for ways to seek out stories.
I have a question for Mona Gable, who asks if either Adiel or Deanna have done any reporting on domestic violence in Indian country and any tips for covering that during the pandemic.
I'm sorry, I didn't hear you cut out when you asked the question.
Oh, let me try again, sorry. The question was whether either of you have done reporting on domestic violence in Indian country, or if you have any suggestions for covering that during the pandemic.
Oh, I do not, unfortunately. I mean, I think it's kind of the same logic as everything else, which is find the local people that are trying to support folks there and approach them with humility and wanting to gain their trust.
Well, I think with that, we're going to close our webinar, and I want to thank everybody for joining us today, to our panelists for all their excellent questions, and to, our panelists for all their excellent remarks, and our audience for all their excellent questions. We'll be sending you all a survey shortly that asks you for your feedback on this seminar and your ideas for future ones that would be useful to you. Please take a moment to fill it out. And also, please feel free to support this project of the Center for Health Journalism by making a donation to support our webinar series. And with that, I would like to thank everybody and wish everybody a good day.